So hypermobility spectrum disorder and the Ehlers-Danlos syndromes are genetic conditions. So it's important to screen families, especially if there is an adult that has this condition, to screen the children to see if they might have this condition, because there's a lot we can do preventatively. We don't want someone to go down the spiral of starting to have pain and then not functioning as well or as much, and then becoming weak and becoming more deconditioned and unable to help themselves. If we can screen someone early and know that in the year following the onset of puberty is when symptoms typically start, we can start to teach children how to care for themselves even before that happens. We can improve nutrition, we can get the right fluids on board so the patient can hold enough blood volume so that they're not feeling lightheaded or dizzy. That can be a big issue. We can look out for triggers or inflammatory responses to things and try to avoid those. We can also encourage the child to become physically active, because exercise is going to have to be a part of life. And so finding an exercise outlet that's fun for the child is really important, and something ideally that's not high impact, because that can become traumatic over time. On that note, I would say that if the only thing the child loves is a high impact sport, that's going to keep them motivated to exercise. I would take the risk and say, all right, we'll stay really in good shape. It's probably more important to be screened by your physical therapist to make sure your muscles are balanced. Wear the correct equipment and padding and that kind of a thing to prevent injury as much as possible. But stay active, because that's the most important piece, I think, that someone can have in terms of keeping their health up when they're young.